So basically, everyone is COVID positive. Like, everyone. Like, that's New York right now. Everyone, thanks for tuning in to my channel. If you're new, thanks for checking me out. Comment and subscribe. I'm really just the entire process of me, through the entire journey of me coming here and just kind of posting my experiences on Instagram and Facebook. I've really been enjoying just engaging with all the nurses or all the healthcare providers out there that are working, just sharing our experiences with each other. Instagram, feel free to send me messages on there. You can comment on this video. I'm always checking for any, notifications in case you guys have questions, especially if you're interested in coming out and you kind of want to just get a heads up of how things are. This video is a 1 week update of how New York is going. I've been here since last Sunday, so a little bit over a week now. And just gonna let you guys know how New York as a city is, as far as my PPE, the type of patients I'm working with, how that's looking like. Just, typical things I know you guys are kind of interested and wanting to know what's happening. I will say this. Prior to me coming here and me being here now, what I'm like hearing and seeing in the news, I will say that that's what I'm seeing at work. I wish I could get on here and say they're full of baloney, don't believe them, but that's exactly what I see on the news is what I'm seeing here. As far as like working conditions, some nurses I have heard that they are working where they have very limited resources on PPE. Where I'm working at, I have not experienced that. But just as far as the severity of this virus, it's very true. Work can get kind of emotional at times. Just seeing these people struggle and suffer like so. And, if I can actually talk with one or two of my patients, because a lot of them, they don't even have the energy to speak, to eat. I'm refusing meals for them because they can't even tolerate their food, they just can't. Just hearing, how, they were at work like me or one of you guys and they got this virus and it's just terrible. And it's just so unfortunate that in a lot of these cases, patients are getting worse before they get better. And, no visitors are allowed in the hospital. You can't see your loved ones. Some of them have said they've sent their loved ones away out of New York when they realized that they were getting sick. It's just very sad. And just being there, you're their primary source of contact. You're getting the phone calls, you're relaying the messages. You can just hear the fear. And in the family members, they want some assurance that I can't say that they're doing better. You hear a lot of the providers on the phone saying, well, I'm not going to say they got better, but they haven't gotten worse, So it's like, it gets pretty emotional. But I just try to go to work with a positive attitude just to keep my own spirits up. That'll encourage me to, do the best that I can for these people, because staff is just spread so thin. I'm working on a med surg unit and we can have up to 8 patients. I've been working with 6 or 7, and they're all COVID positive. They're coming in and they have the high flow oxygen via nasal cannula, or they're wearing a non-rebreather mask, or they're wearing a BiPAP. I'm not working with any ventilator patients on med-surg. Those patients are in ICU. But yeah, the BiPAP, that's like the last intervention. And they're really trying not to intubate, but it's like the BiPAP is either gonna work, and the BiPAP, it's like it has two, it's like connected to like 15 liters, like at one port, then it's connected to another 15 liters. And then it has like a PEEP setting on it also. So they're getting high flow oxygen. And if they're not doing well with that, unfortunately, they have to be intubated, but they have to be pretty bad before they will intubate, because they just don't want to. They don't want to intubate any patients if they don't have to. Something that I have seen them implement in Med-Surg, which is new, is putting the patients in prone position. Us nurses are making sure that they're lying prone, and that's actually like improving oxygenation with a couple of my patients that I have seen, where they may be low 80s, for a period of time, and then the providers are asking that we prone them, and oxygenation is like 90s. Working with these patients, it's a lot because of they can't breathe, so you're dealing with a lot of anxiety. They're scared, they're worried, so it's definitely a lot of work on the nurse. I'm humping from the time I get in to the time I leave. My shift ends at 7. I'm not leaving work until 8:30, like, since I've been here. So it's definitely a lot of work. As far as PPE, I don't know why I feel itchy. As far as PPE, no issues with that. N95 mask, my surgical mask, face shield. I have a hair like bonnet, surgical bonnet thingy on, my gown, and my gloves. My N95 mask, they're asking that we keep it up to 5 days. I think I wore mine for like 3 shifts, and then it just kind of felt like it was wearing. So I got a new one, which I thankfully had no issues with getting a new N95 mask. No questions asked. It did bruise me kind of good up in here. I'm not sure if any of you guys are experiencing that also. So I found this tape at Dollar Tree. It's like it said it was all it said was waterproof tape. It came from Dollar Tree, so their stuff is like super generic, but it literally just said waterproof tape. And I just put Vaseline on my face in the morning. I put that tape on. I'm actually gonna insert some clips so you can see, and that helps me a lot. Maybe you guys can try it and it help you also, but definitely me for sure, because all right here I was just like getting bruises. So that's something I thought to do, and it helps. But PPE, as of right now, no issues with it. We come into work, they have a station there for first and second shift where they give you scrubs to work in, and whatever you came to work in, you take that off, put it in your bag. And at the end of your shift, you change back into your personal clothes. You give them the dirty scrubs that you worked in back. So I really thought, I really liked that. I really appreciated them doing that for us. So the clothes that you were exposed and you worked, you don't have to bring that back home. Because I was planning on just taking my clothes off in the hallway, because that's scary to walk into your house with the clothes, So I was very appreciative that the hospital was doing that for us. As far as the city of New York, it's just a city of lights, really. Like, no one's really out. I drove through Times Square last night. Bare. No one crossing the street. No, nothing. The car was just driving. No traffic. Nothing. No stop and go. Nothing. You see everyone that is out, they're wearing their mask, or they're wearing like a makeshift mask, like with a scarf, just ensuring that their mouth and their nose is covered. That's very important. If you're leaving your house, I don't care, like if you're getting food from a delivery guy, this needs to be covered. Okay, it needs to be covered, protecting you, like, and protecting everyone else. This is a respiratory virus, so portal of entry. Actually, all of this, all of this, okay? But cover this, practice your respiratory etiquette, wash your hands, sanitize. It's not necessary for you to be out in the stores with your gloves, and then you're touching everything in the store with your gloves, okay, but then you're texting on your phone, so whatever you just touched, you just transmit it here, and then you're putting it here, and then you get in your car, you're touching your car door, and then you're getting in your car, you're touching your steering wheel. It's like, what's the point? The same thing that you're doing. It's like, we can't be super anal about it. Like, you can't wipe down every single thing you bring into your house, but we have to have common sense, okay? Like, you're out, when you come in, wash your hands. That's it, okay? We need to educate others that we are around, our family, our loved ones. We need to educate them, and we just need to practice basic respiratory etiquette, hand washing, cover your mouth and your nose or what have you, and that's that, okay? We can't go insane with the gloves, and that's actually ridiculous. It's just ridiculous. But anyways, New York, that's that. Yeah, that's it. That's really all I have to say as far as my first week experience. Thank you to everyone that are like sending me these encouraging text messages, posts, messages on my Facebook and Instagram. All right, guys.